Hi, I'm Dr. Peltier. I'm one of the pediatricians here at Pediatric Associates in Mount Carmel and wanted to congratulate you on your new baby. One of the questions that we commonly get is what to expect during that first visit once you get discharged home from the hospital. So when you are in the hospital, the pediatrician that will actually see your baby will not be one of us. It will be one of the newborn doctors that works for the hospital. They will see your baby, talk to you, answer any of your questions. And then once you go home, we usually like to see you and your baby in a day or two after you go home. There's lots of things that we look for, we look at, and we talk about at that first visit. When you come back, the first thing that'll happen is that one of our medical assistants will weigh your baby, check your baby's length, check your baby's head circumference, and ask if you have any questions. Then one of us will come in the room. The first thing I always like to do is just sort of ask, what questions does the family have, right? So are there specific questions that you want to make sure that you get answered? And then I get to sort of go through my list of questions, and we usually have lots of questions, just kind of trying to assess, are there anything that we need to follow up on or any concerns that we may have about your baby? We'll start with asking you about your pregnancy. Did you have any problems or were there any concerns about the baby during pregnancy? We'll ask about how the delivery went. Were there any interventions that were needed during the delivery? Or did your baby have any issues or complications after they were delivered? Did they have any breathing problems? Were there any feeding problems? Did your baby have any jaundice that needed treated? Those sorts of things. Probably the biggest thing that we focus on that first visit is really, how is your baby feeding? Now, babies lose weight during that first week or so of life. And so we expect that. So number one, when the nurse tells you what your baby weighs, expect it to be lower than what it was when you were in the hospital. We expect that. We're going to talk about feeding. So are you nursing? And if so, is your milk in? How often are you nursing? How long might your baby be nursing for? And how is it going? If you're formula feeding, we'll answer any questions that you may have about formula. We may ask you what formula you're feeding your baby, how many ounces, how often. Are they tolerating their feedings? Are they having any spit up? Are they having bowel movements? What do their bowel movements look like? We know it's normal for initially babies will have a very black, thick, tarry looking stool. And over the next couple of days, that transitions to more of a yellow, sort of looser stool, and it may even have a seedy appearance to it, and that's all completely normal. So plenty of wet diapers, plenty of poopy diapers mean that your baby's probably getting enough to feed, even though their weight may be going down. Other things that we'll talk about are, is your baby jaundiced at all? It's a very common question and a concern that parents have. And I'll say that majority of babies have some degree of jaundice or yellow color to their skin the first couple of days and maybe even the first few weeks of life. Breastfed babies tend to be more jaundiced and tend to have their jaundice last longer than babies that are fed by formula. Most times jaundice doesn't need to be treated or it's not a concern. But other times, if that yellow jaundice gets too high, it can have some risk for your baby. So we'll talk about that. And we may even have to check a bilirubin level, which is a blood test that's done at one of the Cincinnati Children's Labs just down the street from one of our offices. Then, of course, we're going to examine your baby head to toe. We want to make sure that they have a normal exam. We'll feel their soft spot. We'll look in their eyes, we'll look in their mouth, we'll look at their tongue, we listen to heart and lungs, make sure that those sound good. We'll press on your baby's belly and make sure that we don't feel anything that we're not supposed to feel. We'll take a look inside the diaper. If you have a boy that was circumcised, we'll take a look and see how the circumcision's healing. Of course, we'll look for any rashes that your baby may have. In addition to jaundice, babies can have lots of normal newborn rashes that may look scary, but the majority of times they're just normal newborn rashes and they go away on their own, and we talk about that. Again, I always like to just follow up with parents and see if any other questions that they have. Especially if you're a new parent, you may not be sure of how do I take my baby's temperature? When should I take my baby's temperature? When should I call the pediatrician? So we'll talk about all of those things and sort of give you guidance on when to call us. We'll also talk about the office and how to get a hold of us if the office is closed after hours. The majority of times, assuming there's no issues or complications or problems with your baby, they're have a normal exam, they're feeding well, we usually like to see babies back in about a week to check their weight and check in and see how things are going. Usually within a week or so, babies have regained their birth weight and are above birth weight. And then we begin to sort of start the usual checkup schedule. So we see babies at 1 month of age, 2 months of age, 3 and 4 months of age, and then we begin to spread it out after that. Hopefully this video sort of answered some of your questions that you may have as you're anticipating your first visit to us here at Pediatric Associates of Mount Carmel. And if you have any questions before that or after the visit, please reach out to one of us. Congratulations again.